Every year, over 800,000 people die from suicide. This roughly corresponds to one death every 40 seconds. The number of lives lost each year due to suicide exceeds the number of deaths due to homicide and war combined. Suicide is the 15th leading cause of death globally, accounting for 1.4% of all deaths in 2012. Globally, suicide rates are highest for people 70 years and over. Suicide is the 5th leading causes of death among those aged 30 to 49 years in 2012 globally. Suicide is the 2nd leading cause of death in the 15 to 29 age group in 2012 worldwide. 75% of all global suicide deaths occur in low-middle income countries. It is estimated that during 2012 for each adult who died of suicide there were over 20 others who made suicide attempts. Suicide is complex with psychological, social, biological, cultural, and environmental factors involved. The strongest risk factor for suicide is a previous suicide attempt. While mental disorders, namely depression and alcohol use disorders, are a major risk factor for suicide, impulsivity can also play an important role, particularly following a life crisis. In addition, experiencing conflict, disaster, violence, abuse, bereavement, or loss, and isolation are strongly associated with suicidal behavior. Suicide rates are elevated amongst vulnerable groups who experience discrimination, such as refugees and migrants, indigenous peoples, lesbian, gay, bisexual, transgender, intersex, LGBT. Connect, communicate, care. These 3 words symbolize the heart. Connect. Connecting with persons bereaved by suicide or persons with lived experience of suicidal behavior is key to suicide prevention. Be there for someone who has become disconnected and guide them to the support. Communicate. Empowering people to effectively engage with persons at risk of suicide has an important role to play in prevention efforts. Speak openly about suicide in order to dispel myths which surround it. Be cautious with your message and ensure that you are safely care. Governments and service providers need to prioritize suicide prevention. Communities have a key role to play in caring for vulnerable persons and those at risk of suicide by effectively support their needs. We all need to make the effort and take time to care for ourselves.